Hi, I'm Carly Smith and I'm one of the speech pathologists at Recovery Station. I'm going to talk to you today about the importance of safe swallowing coming up to Wednesday the 14th of March is Swallowing Awareness Day. Speech pathologists are highly trained allied health professionals and we provide support to individuals across the lifespan in a range of environments. At Recovery Station, our team of speech pathologists are well regarded for their leading practice, compassion and helping their clients to live a better life with greater independence and fulfillment. They are experts in all therapy from the brain to the diaphragm. We assess and treat communication disorders as well as swallowing disorders. Today, I'm going to be speaking to you about swallowing disorders, including feeding disorders and oral motor difficulties. So why is it important to refer for a swallowing assessment? Well, number one, dysphagia, disordered swallowing, can cause death through aspiration pneumonia or choking. More than 1 million Australians experience dysphagia. That's 1 in 17. We swallow approximately 900 times per day using many different muscles and nerves during the oral, pharyngeal and esophageal phases. We need to make sure that each swallow is as safe as possible. Dysphagia can cause distress, discomfort, reduced participation in social roles, a decline in functioning, and place the person at risk of malnutrition, dehydration, and poor physical and mental health. Dysphagia can cause behavioural changes and cognitive difficulties, including food and drink avoidance, increased worry about eating and drinking, and can affect development. Dysphagia management improves quality of life, increases participation in important social roles, increases safety, and maintains health and wellbeing. So what are the red flags, and when should a referral be made to a speech pathologist for a person with a swallowing issue? Well, the main ones that we are all aware of is when a person is choking on food, fluid, or medications, or when they're reporting that they have difficulty swallowing. But some other red flags considering are related to the person's overall health, such as a decline in their cognitive status or their health, unintended weight loss, or frequent chest infections. The person may have reduced cough strength or reduced breath support. They may be post-stroke or brain injury. They may have a developmental disability or a neurodegenerative disease. Another red flag is a person presenting with voice difficulties or a loss of voice. We also need to consider, are they on a modified diet or thickened fluids? And are they concerned about their swallow safety? So who would you expect to see having swallowing difficulties? People with neurodegenerative disease or neurological symptoms may have swallowing difficulties, as well as people with dementia and people with reduced breath support, including reduced cough strength, people with head and neck cancer or post-radiation, people with tracheostomies or laryngectomies, people with a history of choking on food or fluid or medications, people that are post-stroke, traumatic brain injury or acquired brain injury, people with disability, for example, cerebral palsy, Down syndrome, intellectual disability, and autism spectrum disorders can present with difficulties in chewing, swallowing, clearing the mouth, moderating how much food and drink is ingested, and may have people feeding them. People with mental illness can present with swallowing difficulties, and people with a current mealtime management plan should be reviewed routinely to ensure that they are on the least restrictive and safest diet possible. This is not an exhaustive list. Anyone can experience dysphagia at any point in their life. You may have some questions that you'd like to ask your clients, such as, do you have any difficulties with your eating and drinking or when you're taking your medications? Sometimes people describe it as something going down the wrong way. Do you ever feel uncomfortable when you eat, drink, or take medications? Do you ever cough or choke when you eat, drink, or take medications? Do you feel confident when you eat and drink? Do your loved ones ever worry about your swallowing? Do you find it difficult to communicate your opinions or needs? Do you get frustrated when people don't understand you or you can't express yourself? You could say to the person that it sounds like they may have difficulty, and that must be frustrating. Ask them if they would like you to book an appointment to see a speech pathologist. If you're ever in doubt, call Recovery Station. It's better to be safe than sorry. Swallowing is a priority for the Recovery Station team. Dysphagia can be life-threatening. It's better to be safe than sorry when making a referral. Urgent swallowing reviews are given priority. If you are concerned about an individual, contact Recovery Station on 1300 588 851. Our speech pathologists are also available for staff training on the risks associated with swallowing difficulties. Thank you, and don't forget, Wednesday the 14th of March is Swallowing Awareness Day. I've included an infographic giving some information about the different people that are affected by swallowing disorders and how many times we swallow per day. It's quite a large amount.